a little bit at 1:15, and so let's go ahead. So I thank everybody for coming. Thanks to our grad community for turning out, and I'd also like to thank our panelists who have come. Kevin Kirby is the Vice President for Administration. Yusuf Shamu is the Vice Provost for Research. Allison Vogt is the Associate Dean of Students. Adria Baker is the Executive Director of the Office of International Students and Scholars and Vice Provost. And Kate Cross is the Associate Dean of Graduate Studies, and Angela Raybuck is the expert on all things having to do with electrons and how those turn into images and communication on the screen. And so she's providing the support and the leadership for the event. And so we've gotten a number of questions that have come in, and so we'll start with that list of questions, but you can also ask questions with the link at the bottom, and we'll first go through the questions that already came in, and then move to any new ones with the time that we have. And so the first one is, what are the current plans for graduation? Will there be a large ceremony in December, or will this still be in May? And so for many of the things that we're looking at, that we've got to just do some estimation of where we are, and then some speculation about where we're going. My personal view is it's hard to imagine that we're going to be running a full-scale commencement ceremony in May. We don't have concrete plans for in December. I'm doubtful for December. I'm still optimistic for May. Let's see. How will office hours, recitations, and help sessions work for those on campus? So many of the questions that we've gotten today could go to a variety of levels. I don't know how the office hours will work in your department, and so this is one that's probably not just best pointed at the departmental level, but towards your the instructor that you're working with. And so I think a lot of the office hours and recitations will be done through Zoom. Some might well be done on campus. We got a question about when will we receive information about what rooms we're supposed to report to which days we're allowed to report to campus, et cetera, in the MBA program. And that's a question at a level of detail that I don't know. And so please check with the MBA program on that. The question is, I read that Rice's policy is to provide recordings for dual delivery classes for different time zones from President Lieberman's message, but what if the instructor does not intend to provide the recordings? So for this question, the person who really governs the instruction in the department, it's the chair of the department who governs the faculty. And so if there's some confusion at the faculty level about what's required, the department chair is the person who can intervene and get clarification on that. And so please check in with the chair of your department. Another question is, whoops. Sorry, I've misscrolled here. Let me get back to where I was. Why are graduate students being asked to volunteer at campus testing sites, increasing their time on campus and for no personal benefit or reward? And so this was a request that went out as it honestly was a miscommunication. And so we're not expecting graduate students to volunteer for, there's not an expectation that you should volunteer. And so if you've gotten any pressure to volunteer from your department, most likely they didn't mean any harm, but but a miscommunication happened. And so if you're really feeling pressure to volunteer for things like this, please email to gps@graduate@rice.edu. There have been a number of grad students who want to volunteer for things, and so volunteers are very welcome, but volunteering is not expected. Question is, my advisor is asking me to do something that I think is unsafe. What do I do? And so we've just looked at a number of questions that vary by essentially where the reporting lines lie and where the responsibility lies. If your advisor is asking you to do something that you think is unsafe, that's actually a significant ethics concern, and that should be reported to Ethics Point. Ethics Point is a third-party software that's fully anonymous. It's at www.rice.edu/ethics. So it's really easy to find, just /ethics. And the way this works is if you write in a problem there, it goes to Rice's Director of Internal Audit. And so it goes to someone who's disconnected from the academic part of the campus and who really focuses on as internal audit. This is someone who makes sure that we do things and we do things correctly. The Director of Internal Audit then will read those items and then distribute it appropriately. I get most of those that pertain to graduate studies, and it's completely anonymous. I don't have any way to know who wrote it. And so we then correspond over the through this app, and if at some point the person wants to give me information so that we can speak separately or so we can speak on the phone, we can. If they don't want to do that, then we continue in anonymous mode. And I don't do anything unless I get the green light to do it. And so if I think I know what's going on, but the person doesn't want me to do anything, then I don't. And if you want me to do something, you've really got to give me enough information to understand what's going on. And so if the complaint is something like a faculty member is asking a student to work under unsafe conditions, but the student doesn't want to tell me, I really can't intervene in cases like that. But if you give me enough information to go on, I'll handle it in as delicate a way as is possible. And so in general, in these kinds of issues that we've talked about, when the issue is going on at the departmental level, it's best to talk to the department chair, who actually is the person who can intervene. If you feel that it's too formal to talk to the department chair, you can talk to your graduate administrator as a less formal alternative. If that doesn't seem right, or if you're really worried about conversation within the department, you can also contact GPS. So if you contact graduate@rice.edu, or if you talk to Pia Bird, pia.bird@rice.edu, and we'll make sure that everybody's got these links. Those are anonymous approaches that you can simply have somebody to talk to before resolving whether we should go forward. And a related question, how do I report infractions of the campus COVID rules? I've seen some faculty continue to not wear masks indoor in spaces beyond outside of their private offices. If you feel comfortable talking to the department chair about that, that's certainly possible. If it's something that, if the lack of wearing masks certainly can be a safety issue, and if you want to report that on Ethics Point, feel very free to do so. So now we have a question about the facilities and the space. So this is a question for Kevin. Will classes be held in big classrooms so there's enough room to physically distance from each other?
Hi, everybody. For those of you who don't know me, the reason I'm here today is I have many roles, but today I run the crisis management team. I'm the person you get a Monday update from and other things over the course of the week. Before I came to Rice, I was at the medical center at Columbia, which included the schools of medicine and public health, where I was the chief operating officer. And before that, I worked at the National Institutes of Health. The question about room capacity. So I believe we're just about done mapping every room that is a common space, including the classrooms. And they all have a COVID-19 occupancy sign on them. And so that's the maximum amount of space. And so you'll see a dramatically reduced number from what they can normally hold. And we use the CDC guidance of 6 feet per space between people, and then added another 1.5 feet. So in general, it's at least 7.5 feet apart. And we've either rearranged the furniture in the room, taken the furniture out, or put dots or some kind of marking on the seats to identify where to sit. And we have plenty of space for all 1,100 classes that'll be going on this semester.
Thanks, Kevin. Another question for Kevin. What are the lunch options for grad students?
Well, Kate Cross could probably answer that. She's been working closely with our housing and dining team, but it's essentially you're going to have the same variety of options. So you can go to the Ambassador Cafe in the Student Center. You can go to the Pavilion. You can do what's curbside pickup at the Faculty Club. There'll be options in the serveries for grad students. And so you'll see many of the same kinds of options available. Some of the operations will be different because they'll be safer. But you can find out more about that by contacting Kate or go on the Housing and Dining website.
But another question for Kevin. Do we have anybody at Rice who's worked with Tony Fauci?
Is that a real question?
I just threw that in for you.
I have. When I was at NIH, I worked with Tony Fauci. I thought, well, how did you know that? How did a grad student actually know that?
Adria, what would happen if an international grad student working from home decides to move out of Houston or the US for some time?
Sorry, I didn't unmute myself. Hi, everyone. So I'm over the International Student and Scholar Office, and I'm going to answer it 2 ways. If you're a new F1 or J1 student, you need to, if you are in Houston, or if you're in the United States, you need to come to Houston, and you need to be taking at least 1 3-hour credit hour course in person. And it needs to be something that's, of course you would need with your degree. You can go home and you could study outside of the United States if you wanted to go home and study remotely. But if you're in the United States, you need to be here and taking 1 course. Now, continuing F and J students have the flexibility of studying online, all online, and they can do it whether it's in Houston, elsewhere in the United States, or you can do it abroad.
Thank you. All new F1 and J1 students need to take an in-person class. What happens if I cannot find a course to take in my department?
Well, the registrar has them as face-to-face courses, and we have worked with the departments to try to identify what those courses are, but if you can't find one, contact the chair of your department, who is the one that's been communicating with us. If they can't help you, then go ahead and write graduate@rice.edu and copy oiss@rice.edu. We want to move on that very quickly, though, so that we can make sure that you can maintain your status. And again, that's for the new F and the new J students for the first semester.
Can I begin coursework remotely and then enter the USA and finish the course while in Houston?
Okay, I think I'll take that one too, Seichi. Yes, you can, when you're abroad, if you are a new student, you don't have any kind of immigration status. So you can start taking those courses, but when you enter the United States, again, this is for the new students on an F or J, then when you enter the US, you can finish them when you're here, but make sure that one of those courses is face-to-face. If you run into problems, again, we'll work with you. We need to talk to you about that. If you're continuing, a lot of students will start from abroad and they're going to come in during the semester. You can do that as well if you're continuing. And so yeah, that can happen. Most of the continuing students, not everybody, but a large percentage of them will be maintaining their status while they're abroad, but there's some specifics that we have to work, that you'd work with an advisor on. And we do have Zoom meetings with students all the time.
Thanks, Adria. Question for Yusuf. So for Yusuf, will research phase 3 include the same distance requirements? And Yusuf, if you could also just give us a brief intro about the many hats that you wear at Rice and in these days.
Sure, thank you, Seichi. So I'm Yusuf Shamu, I'm the Vice Provost for Research. I'm also a professor in biosciences, and my area of research is actually in infectious diseases and emerging pathogens. So as you can imagine, I've been tapped to do lots of advising and thinking about this COVID-19 response, and so I'm also a member of the Crisis Management Advisory Committee and other committees around campus for testing and things like that. So with all that being said, I think, you know, we don't know what research phase 3 is going to look like just yet, but I cannot imagine that it won't have the same space guidelines that we have currently with 6-foot distances between people and wearing PPE, because I don't see that as changing in the next several months in the United States. So I think it's likely to be that all those guidelines will stay in place with regard to distancing. But in research phase 2, we're just requiring people to wear masks and to stay 6 feet apart in their laboratory spaces and on campus. So that's pretty much following the same rules as the undergraduates have on campus in that respect. So I think that'll continue.
And again, for Yusuf, are research groups going to be required to maintain daily logs of personnel who came in to shared lab or office spaces for the purposes of contact tracing?
I think it's a good practice. It's not required any longer. I think that I still keep my personal contact log just as a matter of, well, at my age, you know, my memory isn't what it used to be, so I have to write these things down. So, but for, you know, I think it's just a good practice. That way, in case there is an event, it makes the contact tracing process much easier for the questions you get. Now, remember, a contact is really a significant exposure in the sense that, like, it's 15 minutes of talking to somebody, you know, so it's not just you saw them in the hallway, they walked into the room, it's a significant contact time. So it's not just, you know, I passed them in the hallway. It's 15 minutes of working in a space with somebody, for instance.
And a question for Kevin. How often are grad students who work on campus required to be screened?
It depends on your contact time. So if you're on campus a lot and you're around a lot of other people, we'd like to test you every week. That's the same for anybody on campus, right? If you're on campus sort of at least half the time and you're coming in contact with many people, then we want to test you once a week.
And would either Kevin or Yusuf, could you say something about the you know, when we think of ourselves as a high risk individual who ought to be tested a lot, or so if I get, maybe I would say it more concretely, some people think they're high risk and should be tested a lot. As we view it for the purposes of public health, we think more in terms of the risk to the campus. Could either of you say something about how we view frequency of testing relative to how someone interacts with the campus?
I'm happy to do that. I don't know, Kevin, you want to do it, or?
Okay.
I mean, I think the first thing that I think Seichi's touched on is an important thing, which is, what is the definition of risk? Because risk means different things, right? It's a category. So the risk that we're actually seeking to control through the testing is the risk of transmission on the campus. So obviously, if you test me and I test positive, well, I've already got COVID-19, right? So there's no undoing that. So the testing strategies that we're devising, whether it's a survey or being done every week for some individuals, is really about trying to identify how that person's risk is, how many people they contact around them. So the more contacts you have, the more you are a risk in this situation to spread it to other people. So you'll be tested more. It's sort of a proportional testing method, right? Now, if you're in a back office, let's say in the Office of Research, like in this building here, and you don't see anybody pretty much all day, you're not going to get tested very frequently at all. You might get randomly chosen, but you're not going to be tested like a student who's TAing a class with lots of undergraduates or something like that.
And I have to say, I misunderstood that at first. And so, right, I'm a 60-year-old guy. I've got type A blood. And so I think of myself as higher risk than most. And I was thinking that I should get tested more than most. But the fact is, by the time you test me and find out that I'm positive, I'm sick already. But the likelihood I'm going to infect anybody else at Rice is pretty low. So I'm in Allen Center. I might see 3 people a day here. I teach, and I'll teach in person, but I've got a class of 7 people who I'll see for an hour a week. And I've got a lab of 3 people. The likelihood that I'm going to get someone else sick is really, I think, very low. And so the need to test me actually turns out to be pretty low. So anyway, it made sense to me after it was explained to me. For Kevin, how is Rice handling contact tracing and reporting to the larger community?
So we had the first case in Houston on March 5th. And so we have lots of experience in doing this. We follow the CDC guidelines for contact tracing, which mean that you had to have had an exposure being within 6 feet of somebody for 15 minutes. So we have a team of almost 20 people who are trained in contact tracing. They interview the person who's tested positive and ask, based on the CDC criteria, who they've come in contact with. And then they contact those people and talk to them about their exposure and whether there's a need for quarantine for them. And
a related question, what parameters are being used to determine which individuals need to quarantine following exposure to a positive case in a work or lab environment, particularly for research groups that share student offices and break rooms? So I guess the latter part of the question is the primary difference from the previous.
It's the same thing. If you just go on the CDC website, you'll see the very detailed protocols for contact tracing.
And so I'll field this one. How will Rice protect graduate student teaching assistants who will have to interact with undergraduates who live on campus, who are inevitably assuming higher risk through social interactions and sharing spaces? And so we need to handle the PPE appropriately, handle the distance appropriately. And so I'll be teaching undergrads in person, but I'm going to keep appropriate distance from them. I'll be wearing a mask, and so I'm not very worried about it. Will teaching assistants be informed if any of their students test positive for COVID, Kevin?
It depends. If they've had contact with them, yes.
Right.
We've been in the classroom with them, yes.
And let's see. So we have a series of questions that have a similar concern, which is about what other universities have done, what other universities have experienced, and how we view Rice in that context. And so let me just put forward one of these questions that came through first, and I'll ask Yusuf. UNC Chapel Hill had 4 clusters in their student housing within a week of classes starting. Why will things go differently at Rice, and is Rice reevaluating opening plans in light of the situation at UNC and other universities? And just to give the details of other related questions, Stanford and Hopkins were also mentioned.
Sure. This is a really good question. I think each school has to understand their student demographic, and to be clear, we have done the best we can to reduce the risk and maximize the safety on this campus. But it wouldn't be safe for me to say this is you cannot get COVID-19 on this campus. We're doing the best we can to mitigate that risk, but the public health strategies rely on essentially the compliance of the public, right? So if people go out and go to bars or go to parties that's going to put everything we've worked for at risk. And that's what you see at some of these other campuses. That's what happened at Notre Dame. That's what happened at UNC. And so we've worked very hard with our students to the culture of care documents that Seichi sent out to both the graduate students and the undergraduates to really emphasize that this is a team effort. It's a joint effort. Now, I think that we have some advantages here over many of these other schools. We're smaller. Our testing program is more aggressive than almost any country that I can think of in the United States. We're testing across the population very significantly, and that is an advantage that many schools have had to close because they couldn't arrange the testing programs and get the logistics of testing to happen on their campus. And sometimes it's because the school is very large, and sometimes it's because they just don't have the resources to do it. So in some sense, we've been working on this, Kevin and I have been working on this all really since spring break of last year, how to think about testing on this campus effectively. But the testing only works with the PPE, it only works with the distancing, it works with making the buildings safer, as Kevin talked about earlier. These are all layers of defense. So it's a probabilistic argument if you think about it. I can decrease the probability of a viral transmission by reducing the number of people on campus who are positive or asymptomatically positive as spreaders. I can reduce the possibility of transmission by wearing masks. I can reduce the probability of transmission by staying more than 6 feet apart. I can reduce the probability by making sure the buildings are disinfected on a routine basis, and that we're all educated, right? So and I think that does make us distinctively different in some respects. I think we've got a very holistic strategy. Not that those other schools' plans were not good, but I don't know what their plans were in detail, right? I do think those other schools in some cases closed for other reasons as well. So in the Northeast, for instance, they feel that the second wave is rolling up towards the Mid-Atlantic region and towards New England again. Now, we'll see if that happens or not. But the other thing they had to deal with is mandatory 2-week quarantines for their students coming from outside the state of New York, for instance. And so that was making it very difficult for them to open with the idea that they had to bring everybody into the state and then quarantine them in isolation for 2 weeks. So there are a lot of logistics and nuance to each of these. But the main thing that's really unhinging most of these schools is, this going out and partying, right? And so I think we're trying to put a lot of emphasis on education of our students. And I think we have so far good indications that this summer our graduate students were great, right? We did research all summer long, basically, and had no cases of viral transmission on this campus among our graduate students, right? In the laboratory in particular, right? Or on this campus. So I think we've demonstrated the ability to do things right, but that is no guarantee of future success. But I do think we are distinctively different because of our size and because of the resources we've put into this. But again, it all comes down to the public, all public by public, I mean all of us on this call.
And I've spoken to colleagues at other institutions, and they asked how we're approaching things and if we're able to get enough tests. And I said, well, we've got 60,000 tests that we can do. And 2 of my colleagues thought that I was just out of my mind, that I didn't know what the right number was. And so it was really phenomenal how Kevin and Yusuf have been able to make the connections at TMC and get the testing capacity for us. It's certainly a phenomenal advantage that we're a small institution that's sitting on the side of the largest medical center in the world. So that's a great asset for us.
We also get other things from the Texas Medical Center. All our tests are coming back essentially within 24 hours, and many within 8. Many of you have probably been tested. 22% of our tests were given to graduate students here since August 1st. And those tests are coming back remarkably fast, which is really important so that you could then contact trace any positive exposure. If you see what's going on in the city of Houston and you're getting times of 5, 6, 7 days, it's like you were never tested. It's good for you to know, but how many other people you've come in contact with over the time. Plus, we're getting lots of expertise from UT Health, from Baylor College of Medicine, and from Methodist Hospital about very specific things around infection control, about testing frequency, about how to think about people who might be super spreaders. And so this is really important to our strategy. And
there's a question just came in on the Q&A that that I'll skip to because it's in the context of testing and the staff. So the question is, more than half of Rice's positive cases are staff. What is Rice doing to make sure that classes and research aren't putting our staff in harm's way unnecessarily? And Kevin oversees most of the staff. So Kevin, if I could give you that question.
Yeah, one of the principles that we've been working on for 5 months now is the principle of choice. It's harder for staff because some of them must come to campus, but in fact, less than half of the staff will be on campus over the fall semester, or at least not full-time on the campus. Then there are people who have to come every day, if you're on a custodial crew or others. And so we've required every supervisor to have an individual work plan and a return to campus plan for every single employee that takes into account their special circumstances. And if they have particular health concerns or childcare concerns, we're trying to take those into account to the maximum possible extent. Then as we pick one category, but I could do this for every category of staff. So there was a question about our custodial staff. And so what have we done? So they have more training than other staff. They've been given all the PPE that they need to use. We've changed some of their work procedures so that they come in contact with less people. So for example, they're not entering a student room, or they're not entering an office to empty trash. We're asking people to put that out in the central place in the hallway, so they have less contact time. We're asking some of our custodial staff are working in the evenings now, so they have less contact time. So we're doing lots of modifications to the work environment so that we're not putting people in harm's way unnecessarily.
And thanks. Let's see. So, sorry, going back to the use of a related question. What is the university's off-ramp plan for if there is an outbreak? What will trigger it and how will it take place? Will it be a university-wide policy, or will it apply to certain bodies, say undergrads as opposed to graduates?
Yeah, that's a good question. I think, there is no one trigger point, right? Because there's no way this disease will necessarily manifest itself on this campus, right? So I think we have a lot of options if something were to happen on campus, and it depends a lot on where it would happen on campus. So for instance, if we had, an increase in cases, say in a residential college on campus, that's going to be different than if we had an increase in cases, say in a specific building environment, let's say like one of the buildings on campus. And we don't have to go to remote. It's not a binary decision, all in or all out. We can make decisions like what Notre Dame did, for instance. They had a serious outbreak, and they decided to go online for 2 weeks for their undergraduates, right? And so they're going to reevaluate. And I think part of what I think David Lebron and the crisis team, including me and Kevin and Seichi, have always sort of, thought very carefully about is we try to take in the information and make good decisions in a dynamic and responsive and agile way, so that we don't sort of fall into this sort of lockstep thinking. We try to understand the circumstances to make the decisions. So, for instance, it's unlikely we would just make a quick decision like that. We might decide to keep research happening, presumably. That would be one of the last things we would think about shutting down, because we've already demonstrated through all the summer that we can conduct those activities safely on this campus. And that was even before we had testing. So I don't imagine it being a binary decision. I imagine it's going to be essentially a series of potential changes we would make in how we deliver our education, rather than a blunt instrument kind of approach. And in terms of what the triggers would be, an outbreak on campus would of course be very serious. But if there was, for instance, a significant issue with ICU beds in the Texas Medical Center, that would cause us to be alarmed, right? Because the community is really struggling. The other thing I'm looking at very carefully, and this does apply specifically to graduate students and undergraduate students, is compliance. If we saw that people were not actually wearing their PPE or not actually adhering to the practices that we put into place to mitigate the spread of the virus, that would also cause changes, because then we couldn't operate safely. We know we wouldn't be able to operate safely if people didn't actually obey these rules, and that means wearing masks and staying socially distant or physically distanced. So I think it's a gradient of activities you can imagine doing. It's not going to be like a sledgehammer on or off. And I think the last thing I think we would want to close actually is are the research activities on our campus, because it does strongly adversely affect the progress of our graduate students.
I got to add to that, Yusuf. You know, we've already made changes just in the last couple of weeks. We went from class sizes of 50 down to 25. We doubled the number of testing that we're doing on campus. We changed the mask requirement, which was controversial, to all the time outdoors. And we track that, and we're seeing that starting to work. So our UPD stopped 700 people in the last 10 days. 500 of them were neighborhood people. And so every day we see that number of neighbors not wearing masks going down. And so it's going in the right direction. So we have many, many, many levers like that to start to adjust both behavior and operations on the campus.
And let's see, a related question that just came in on testing. To clarify the testing question, if we think that we're at a higher risk to the community and public health, should we schedule our own frequent COVID tests every week or two? Or should we wait to be contacted about scheduling a test? Kevin, do you feel you want to handle that?
I'm not quite sure exactly what the question means, but look, if you think that you are being exposed to other people. So for example, if your spouse works in the medical center and you feel like you might be getting more exposure and you're coming to campus every day and you're going to work in one of the research labs, tell us. Tell your department chair and we'll make sure you get tested every week.
Thanks.
You know, I've said this in some of my notes to the campus, you know, it's, and as Yusuf said, we're either all going to thrive together or we're all going to get sick together. And being tested when you feel like you're around other people a lot, wearing a mask, right? It's an act of reciprocity, right? I protect you and you protect me, right? And so we're all in this together. And so we need all of us to bring our best selves, right, to the environment and your best ideas. You know, Seichi, Yusuf, me, others, we don't have all the best ideas. And so if you have ideas about things we should change on campus, things to improve, please let us know.
And just one more thing to add to Kevin, I think those are great points. Look at your own health really closely, right? That's again part of this responsibility we have to each other. In past years, you know, people had a sniffle, myself included, and they came to work, and you know, I'm a trooper, I'm in it to, you know, show the boss I can come in and no matter how sick I am and get my gel run or whatever it is I was going to do. That's not the situation we're in now. Now, if you're feeling ill, you've got your headache, you're sick, you're coughing, whatever, stay home. You have to protect others, and that's the way to think of it. I am protecting other people, and I need to be careful now because nobody wants to be sick, and there's this, some people perceive sometimes a stigma around this, and we've seen this before. I don't want to have COVID, and there's a little bit of self-denial, right? There was 3 or 4 weeks ago, I wasn't feeling particularly well on a certain morning, and I'm like, oh my gosh, am I going to get sick? And I was scared, right? Because I don't want to be sick at my age range and my blood type and ethnicity and all that. And B, I was a little bit like, what are people going to think about me, right? There's a little bit of like, oh, I don't want to be the typhoid Mary, right? That everybody's going to look at Yusuf, who's on the crisis team, and he gets sick. But then I thought about it and I said, well, look, you got to practice what you preach. If I don't feel well, I'm staying home. I stayed home. It turns out, you know, it was nothing, just some allergies, and it was fine. Got tested, I'm negative, right? But you have to defer on the side of caution in this, just for this time period. It's different, and it's different talking and interacting with people, getting used to the idea of talking to them from 6 feet away, and it's hard because you have a mask on, you have to project a little bit more, and it's awkward, and you have to get used to this new world that we're in until a vaccine comes out, and then we can get back to hopefully our old lives, right? But until we have a vaccine, we have to be comfortable in this space, and we have to protect each other. Really have to protect each other.
Let's see. Harris County has been at red level 1 for most of the summer with severe and uncontrolled community transmission, and in-person instruction is not recommended at this time. Why did the university make the decision to bring students to campus this fall as cases and COVID ICU occupancy rose? And then a related question was, why risk bringing students back at all? What is the benefit to risking these lives? And so maybe I'll do a bit of an intro. I don't have the technical expertise that Kevin and Yusuf have, but I think that there's part of our community that really it feels that okay, I'm scared. The world's a scary place, and I'm not going anywhere until there's a vaccine and the world is safe. We don't know when that's going to be. So there might be a vaccine within the next 6 months. Will there be a fully reliable tested vaccine that everybody has access to in the next 6 months? I very much doubt it. So as a vaccine is rolled out, you know, we'll see how good it is. I think if it's more than 50% effective is where the CDC has its cutoff for testing. And so the situation that we're facing is not a one semester issue, but essentially it's going to be a way of life for us for some time to deal with COVID risk. And we're not really open to shutting our lives down for the next couple of years as we see what happens. And so it's going to be a matter of managing the risk. Yusuf, Kevin, do either of you have anything else to say on that topic?
I do, but go ahead, Yusuf.
I think what we do is important as a university, and it's important in a couple ways. One way is, of course, our educational and research mission. So all of you are graduate students who are working towards advanced degrees. What you do in your scholarship is important, right? And it cannot, in most cases, it can't be delivered online. In some cases, it can be done online. If you're a theorist, it can be done online. But if you're an experimentalist, you work with big lasers, you can't do that at home. And that's part of your training. And so we are an essential activity. I also think, I believe very deeply in practicing what you preach, right? So we stand for values here, knowledge, education, helping the common good. We do that through our scholarship. And I think that's an important mission that we have. You know, when I order something from Amazon and somebody delivers it to my door, I've thought to myself, well, why? I didn't need that. That wasn't essential rations for my survival. I just wanted that item. And if you think about it, I put somebody's life at risk to put a package on my front door. And so I think there's a level at which I think we have to show as scholars that we are willing to engage the same level of participation that we're asking other people on our campus and in our community to undertake for essential activities like ours, education. So and we have choice here from you know, our faculty in terms of how they teach, and it's tougher for graduate students who are in labs because you can't have a home lab. So I think there's a lot of stress that comes from that, but I think in the end, I'm very proud of what we do, and I think it's worth engaging this level of risk. And if the risk proves to be too high, we will change, as Kevin pointed out.
Yeah, if you'll remember, so we've got 4 principles that every one of our decisions can be traced back to. And of course, one of them is safety. And for those of you who were on campus back in the spring, you may remember that we essentially closed down most of the university. And we were just about the first ones in the country to do that. It was very controversial at the time. It was a very hard decision to make because we were prioritizing safety from what we perceived the environment to be. And within a week, every one of our peers in the city and the NBA and others had stopped. And so we'll do those things if they become necessary.
So, and another question for Kevin, since he governs this part of our university. How will Rice protect custodial staff who are disproportionately from minority communities who are placed at increased risk of infection, having to clean shared spaces for many undergrads and other members of the Rice community? Will Rice bear the financial responsibility for their short and long-term medical care infected at work.
I previously answered that question, Seichi, but you added on a second part to that. So the answer is, will we cover them? And yes, they get covered through workman's compensation or the university's health insurance. The other thing that I didn't mention earlier and that Yusuf brought up is this year we gave everybody a sick leave bank of another 5 days of sick leave so that they wouldn't be tempted to come to work if they weren't feeling well.
Will Rice change the grading option to pass-fail this semester as well?
Mm-hmm.
We're operating on the normal grading structure this semester. I'd expect that we'll stay there, but if Faculty Senate views it as a problem, they can certainly revisit. Where will the Zoom link be if students want to audit a fully online class? So the answer to that is students must formally register as auditors to gain access to a course. And so it's not possible to simply jump in and show up. There's a registration mechanism in the registrar's office. So it should be obvious to you at registrar.rice.edu. Will the university switch testing to saliva tests instead of nose swabs? Yusuf, want to say something about that?
I think we would all like to have a really good saliva test for lots of good reasons. I had my, when I got my COVID-19 test, I didn't enjoy it a whole heck of a lot. So I can't imagine wanting to get it all the time. So I think what's really interesting is that we have a project here on campus in Rebecca Cordham's lab to actually do saliva-based testing. And we're hoping to pilot that in about a month or so. So I think the transition will be great if we can move towards saliva tests. As Kevin has indicated, the main driver of our concerns around viral transmission are super spreaders that actually do most of the damage in any population. So you're better off testing much more frequently, even if a test isn't as sensitive as a PCR test. If, in the dream world, if it was just like I lick a piece of paper and it would turn pink if I had COVID-19, that would be the easiest thing you could imagine doing every day, right? But if you answer the equivalent, I'm going to spit in the tube every 2 days and put it in this box over here, that would be also ideal. So I think that if you look towards next semester, for sure, I think that's the direction that the not just Rice, but many places are going, is towards saliva testing, because it would be so much easier in many respects. So I'm very optimistic about that. But for this semester, we're going to be using the nasopharyngeal swabs and continuing with that until we have a better technology. Does that make sense, Kevin? Does that seem right?
Yep.
And I think that this one will go mostly to Yusuf, and I'll add some as well. So during the RS1 and RS2 openings, PIs were responsible for disseminating important university information regarding shared spaces, mask hygiene, physical distancing protocols, and even the start dates for these stages. This resulted in graduate researchers that share common spaces to be informed of and implementing new university policies at different times, days, and even not necessarily being aware of all the new policies. How will the university address these communication lags as research policies change so that graduate students can make decisions about how these policies may affect their individual risk in a timely manner? And I think this is a good point. So this is a fair point. And so overall, I think that we've wanted the faculty to know where things were going before announcing it broadly, in part to confer with them, and in part to make sure that they knew the precise issues before they brought them to the grad students. But I think that we do need to do a more complete job of making sure that the grad students are brought in shortly thereafter. So I think I agree on that point. We have been sending out regular mailings through the Grad Student Digest on Wednesdays, and I hope everybody is opening those and reading them, because there's a lot of information there, and we know that we don't all get opened. Yusuf, do you have anything to
I agree. I think we'll, in the future, all the communications will go out directly to, the PIs and the graduate students. I think initially with the research stage one, it was very focused on experimental laboratories with very specific conditions around square footage and very detailed planning logs, because the scope of the operation was smaller and more focused. But I think now that we're sort of all back to campus, all the communications will go out to everybody so that everybody can have the same conversations across the campus. So I agree with Seichi.
And let's see, we're running out of time, and so I'm going to digest a couple of questions into one. And so there are a number of emails on or questions on it in a similar direction about communication to the grad students, and that note that a lot of the university information has emphasized the undergrads more than the grad students. And I think that, that I agree. So if you count up the number of times that the word undergrad is used relative to graduate student, and I know some people are doing that arithmetic, and it does favor the undergrads. I'd also note that, I got these same kinds of alerts when I was interim provost. And so when people say that the university doesn't care about grad students, when I was interim provost, I still really cared about the grad students a whole lot more than I cared about the undergrads, to be candid. But the same impression I think remained. I'd note that that undergrad governance is just a lot more centralized than the graduate governance. So I hear from the undergrads that they think that the faculty don't care about them very much, because most of the faculty are indeed more focused on the grad students and on the local research than they are on the undergrads. But I think we can do better, both in terms of the communication and the emphasis. Much of the issue, honestly, has been that the risk of a big viral outbreak in the undergrad colleges is so much higher than for the grad students who live on their own in an apartment and generally have a more thoughtful and careful lifestyle and have gotten their mistakes out of the way before getting to grad school. That I think it is true that we worry about the undergrads more than the grad students who overall have behaved very responsibly and thoughtfully and simply haven't tested positive very much. And I think there's just been one case to date on campus, right, Kevin?
I'm sorry, that
there's one positive grad student test on campus.
I'd have to look up the stats. I'll look them up while you go on to your next question.
I think that's right. I think there's one currently, but I'm not sure yet. I should always check because we're testing all the time. So in general,
yes, one.
The positivity rate of the Rice community is less than 0.5%. So we are amazingly diligent, I would say, as a group, in terms of populations like the city of Houston, et cetera. So I think, and the graduate student rate, if you think about it, is even lower than that. One case over several weeks. So the graduate students and undergraduates have proven to be, I think, have been paying attention to all the guidance.
That was we also had 4 grad students who tested positive up through the end of July.
And another question that came in that I don't think we'll be able to spend too much time on, but was about on-campus transmission. The on-campus transmission has been very low, so the overwhelming majority was people pick up the virus in their non-Rice lives.
The only one that we believe occurred on campus, it's one out of 80 some. But in part that's to be expected because we've been remote. right? Most people have not been on campus. And so now we're going to have about half the normal population on campus this semester that we did last fall.
So in the few minutes we have left, if we can call on Allison Vogt, who's the Associate Dean of Students.
Hi, everyone. I just wanted to let you all know that we have resources available to you on campus. We understand that COVID-19 and all of the other things that are happening in our world today have created some anxiety and possibly a little depression in people. Having to be isolated and at home has, I'm sure, been difficult, changing the way that you work and the way that you study. So I wanted to make sure that you all understand that we have the Wellbeing and Counseling Center at Rice. Right now we are offering virtual sessions. So you don't even have to come in. You can get the sessions for free. It's covered underneath the student health fee. To do that, all you have to do is call 713-348-3311 or email wellbeing@rice.edu. We also have services through our SAFE program in case anyone is experiencing any forms of interpersonal violence, which we know has been going up more in the isolation during COVID. So if anyone you know, or if you yourself are experiencing forms of interpersonal violence, including domestic violence, we have that program to be able to assist you. And you just dial 3311 and you will receive those assistance.
Ready? So we're 1 minute from 3 o'clock. So I'm grateful to everybody for coming out, both the participants and the panelists. And let's find another time to chat again soon. I think that anyway, maybe that's a good place to leave it. Remember that you can write into graduate@rice.edu if you've got issues that need attention. So thank you all.
Thank you.